Good afternoon, everyone. Thank you for taking the time out of your day to join us for today's webinar presentation, Cinderella Improvement Activities. My name is Laura Waltz, and I am the Director of Clinical Quality Experts. Before I hand over the presentation over to our team, I would like to make a few general announcements. First, today's session will be recorded. The recording will be distributed to our viewers and will also be made available on our website, www.clinicalqualityexperts.com. And once the video has been processed, we will post it. Also, we will be holding a question and answer session at the end of the presentation. Please feel free to submit any questions that you have in the questions section in the meeting's control panel. We will do our best to get to as many questions as we can, but if we happen to run out of time, we'll be sure to follow up with an answer after the webinar has ended. Our speakers today bring years of experience in assisting providers achieve success in the complex world of regulatory and incentive payment programs. Megan Fries is our Senior Account Manager, and Jennifer Jacquez joined our team of experts this year. Both have an extensive clinical background and a deep understanding of the MIPS program, and they have been looking forward to sharing what they know about today's topic, MIPS improvement activities. Megan, the floor is yours.
Thank you, Laura. As she mentioned, we're going to be talking about improvement activities today. You can go to the next slide, Jenny. There we go. So you're going to hear me say it a lot. Improvement activities are just what it says on the tin. I really want everybody to listen and think about these improvement activities in terms of your own practice, improving some portion of your workflow or patient outcomes and what it can really mean for you. So, like I said, we're going to say it and I'm going to talk about it a lot, but we really do want to make sure that you're picking an improvement activity that's actually improving and going to give you some benefit back. You can go to the next slide. All right, so first we're going to start with an introduction to improvement activities. So first of all, what are improvement activities? So we are given the opportunity to take time to improve some part of your practice, your workflow, or patient outcomes. And where you can find more information about that is on the CMS website. So qpp.cms.com. And then when you're there, in the resources tab in the upper right-hand corner, you can search for exactly what is here in quotation marks, and that will return exactly this set of documents. So you're looking for 2021 or whatever year you're looking for, improvement activities inventory. That's going to include several documents. You're going to get a list of improvement activities. You will also get a list of validation criteria. That is super important. The validation criteria is the information that you need to know in order to make sure that you have the correct documentation. It's what's going to be required in order to prove that you did this activity during an audit. So validation criteria is super important information to have, and you can find it in the inventory. Who has to participate? So if you are doing MIPS as an individual, obviously just that one individual has to participate in the improvement activity, unless sometimes there are activities which require other people within the office, sometimes somebody from the admin team to participate in, say, like meetings or something like that. So obviously if the measure specifically requires it, you have to involve other people from the practice. But and also if you are doing a group attestation, then 50% of the providers in your group have to participate. So if you have an odd number, then you have to, say 3 out of 5. You can't just do 2 out of 5. You would have to do the 3. So yeah, so just 50% of the providers. You can go to the next slide. Okay, so how many improvement activities do you need? So if you are a small practice, and CMS defines a small practice as 15 or fewer providers. If you're a small practice, then you have to choose an activity that is one activity that is high weighted, or you can select 2 activities that are medium weighted activities. Each of the activities is going to be weighted either high or medium, and they will be listed on the side so you can see and tell which ones are high and which ones are medium when we're going over the measures. Large practices, which are 16 or more providers, have to do twice as many measures. So you either have to do 2 high-weighted activities, or 1 high and 2 medium, or 4 medium-weighted activities. Next slide, please. Okay, so things that you want to keep in mind while we're going through the activities in a moment. First of all, the name says it all. Improvement activities are easier when you pick something you actually want to improve. If you're just selecting something because it seems easy or the documentation is easy to get, you're really doing yourself a disservice. We really want you to choose activities that are meaningful for your practice, because that's what they're here for. First impressions only. So every activity that we talk about today could have its own webinar. There's a lot of validation criteria. There's over 106 measures, and I don't have all of the validation criteria information memorized. So we are going to introduce you to measures, get you thinking about certain subcategories and activities that might be good for your practice, but this is certainly not the only information that you should gather in order to make your decisions. I want you to look up the improvement activity data validation criteria to make sure that the measure really is right for you. Also, you can put your favorites on repeat. You can do a lot of these measures year after year after year. So if you find one that's working for you, you can keep doing it. There are a few exceptions though. Some measures do specifically say in the validation criteria that you cannot repeat them year after year, or that you have to wait a certain amount of years before you can do that activity again. So keep that in mind. Again, that's another really good reason why I want you to look at the data validation criteria. Next slide, please. We are going to pause for 30 seconds for a poll. You should see the poll on your screen here, and you can answer it there or in your control panel for the meeting. All right, so we will be getting into the actual activities now. We're going to do these by subcategory, and the first one we're going to start out with is one of my top 3 subcategories that are my favorite, which is expand practice access. This category looks at ways to expand patient access to providers as well as provider access to resources. Next slide, please. So when we're talking about these measures, the activities, excuse me, I'm going to ask you a question. If you say yes to the question, then this activity might be a good one for you. On the left-hand side of the screen in the blue box, you're going to see that activity ID number, so you can use that to easily search for this measure. The text that's underneath it is also the name of the activity, so you can research it that way as well. In the gray box, we're going to have some information. Like I mentioned, this is not the end-all be-all. You'll have to look up the measure, but that is just a little bit of information to help you decide if this activity needs further research. And then in the green circle, we're going to give you whether it's a high-weighted activity or a medium-weighted activity. So the first one is, are you interested in giving CMS feedback on their QPP website and toolkits to make them more accessible for other providers? If you are interested in giving up your time in about 30 to 60-minute sessions, then you can go to CMS's website and, you can email that email address down there at the bottom, CMSQPF feedback at ketchum.com, and then that is how you will sign up to do the QPP website and toolkit sessions. So next slide, please. The next section we're going to be talking about is population management. This one focuses on improving care to particular groups of patients. Next slide. All right, so the first activity in this section is, are you interested in decreasing healthcare disparities which affect underserved communities? If that answer is yes, you can research IAPM 6. This one might be a good one for you. It lists a bunch of ways that you can meet this activity, but also at the very bottom there is a website there where you can go and research more ways, more projects or ways that you can meet this activity. This is a medium weighted activity. So if you're a small practice, you'd have to choose at least one other measure. If you're a large practice, perhaps up to 3 extra. Next one. All right. Do you serve and panel patients with chronic conditions? So if you are a provider that is providing those types of services, then you can use evidence-based care for chronic conditions, pre-visit planning, reminders, or outreach. Those kinds of things will satisfy the requirements for IAPM 13. It is also a medium-weighted activity. Next slide, please. Does your office help patients with advanced care planning or living will? If you're providing those types of services, and that would be educating your providers on how to address those types of things or implement a procedure that helps patients create those types of documents, and then you would have to keep that documentation in the medical record, then this measure might be a good one for you. This one is IAPM 21, and it is also a medium-weighted activity. Next slide, please. Care coordination is by far my favorite category. This category has a plethora of activities that are all mostly my favorite activities. This one is going to look at activities that have to do with the transfer or referral of care. Next slide, please. All right, so the first one is, have you made improvements to the way that you deliver test results, specifically delivering abnormal test results to patients in a timely way so as to reduce the harm of that patient by not receiving those test results in a timely fashion? If that sounds like you, this is a medium weight activity, and you'll be looking for IACC 2. Next slide, please. Are you interested in improving the care coordination process for patients scheduled for outpatient procedures? When we schedule surgery for outpatient or other outpatient procedures, we have some kind of documentation that's moving from our office to the facility that the procedure is taking place. And that process of the care coordination of that patient's information transferring from your practice to them is one way that you can improve your practices to help patients get scheduled quicker, or perhaps maybe understand their pre-op and post-op instructions a little bit better, or just making sure that the hospital or other facility is, treating your patients the way that you want them to be treated, or giving the care that you've asked for, or prepping them in a certain way. So if that sounds like something that you could improve upon, IACC 8 is a medium-weighted activity. Next slide, please. Do you share individualized care plans with at-risk patients and their caregivers? So we're talking about patients who are at risk, perhaps patients in nursing homes, or that have conditions in which they're unable to care for themselves, or some other type of at-risk patients, and creating individualized care plans for them and sharing them with the person or their caregiver so that they are able to get the resources that they need in order to stick with their care plans that you've implemented. If that sounds like you, then you can look up IACC 9, and that is a medium-weighted activity. Next slide, please. Do you transition and panel patients to new settings? So if you are a provider that is helping and panel patients, if you're on a panel of providers for a patient, and you are transferring them or in the process of transferring them to another facility, either hospital or transitional care, step-down services, things like that, then you can improve the standard operation of that transfer of information. If that sounds like something that you can improve upon, then IACC 11 is a measure for you, and that is a medium-weighted activity. Next slide, please. Do you participate in health information exchange outside of your EHR to communicate with providers about patient care within your health network? So this is outside of what our regular direct messaging, our in and outbound referrals for the PI category. This is above and beyond that. So you're using a health information exchange that is part of a healthcare network. If you're part of a broader healthcare network and working within a broad healthcare network, then you can use their health information exchange. Typically, they'll have one. And then if you're utilizing that in a meaningful way and you can prove it and document it, then this measure is for you. Also, you can use open notes to utilize bidirectional information from a patient portal as well. This measure is IACC 13. It is a medium weighted activity. Next slide, please. The whole care coordination category is my favorite. I have so many measures from this category. Do you participate in perioperative surgical home model? This one is pretty self-explanatory. If you're following this, this perioperative surgical home model, then you are able to report this activity. So that is limit post-surgical ER visits, create comprehensive discharge plans, standardized treatment and communication and education to patients. So that measure is, or activity rather, is IACC 15. It is also a medium weighted activity. You'll notice most of them are medium. There are very few high weighted activities in the entire 106 activities that there are. So the vast majority of these are medium weight activities. Next slide, please. All right, would you report MACRA patient relationship code modifiers in your Medicare claims? So those are the codes where you are describing your relationship to the patient. So if you, there are 5 of them, I think, or 6. If you're willing to use those HCPCS codes on your Medicare claims for at least 90 days, then you can report this measure or this activity. This one is IACC 19. And it is a high-weighted activity. So if you're willing to do this one, if you're a small practice, this is the only thing you would have to do. All right, next slide, please. At this time, we're going to take another poll. So we will wait a moment while you answer this on your screen or in the control panel in the poll section. Okay, the next category we're going to look at is beneficiary engagement. This is all about involving the patient and their caregivers in their care. Next slide, please. This activity wants to know, do you use electronic means to collect patient-generated data with an open feedback loop? So a lot of your patient portals may be able to do this. You should check and see. Sometimes the owners of the portal or the company that provides it to you can let you know if it can be used for certain activities. But if they can't, then you know, I encourage you to read the data validation criteria. But essentially, what we're doing here is allowing patients to create or generate data for you. So that can be data that they wrote down, like a medication list. Or it can be data that they have retrieved from another practice or hospital visit, and they can scan that in or take pictures of it and send it to you on the patient portal. And then you would need to be able to give them feedback, let them know that you received it and be able to answer questions regarding it. So that is a high-weighted activity, and the activity ID here is IABE 14. Next slide, please. Do you increase the efficiency of office visits by promoting patient engagement and gathering pre-visit information? Again, this one can probably be done in your patient portal or by using other means. If you don't want to do it electronically, there's not a requirement for that. But you would use workflows to engage the patient prior to their visit. So you could schedule or have them do targeted pre-visit laboratory testing, but those things would have to be resulted and available during the patient's following appointment. So there are certain restrictions and requirements on this one. Again, the data validation criteria will tell you this is a medium weight activity, and it is IABE 22. Next slide, please. Do you provide estimated costs of service and or provide financial counseling, including alternative payment methods? So this one is basically what it says. Financial counseling, there are some requirements on what counts as financial counseling, and you do also have to give them a estimated cost of the service and an exploration of different payment options. So this is not one of those things where they're having surgery and you tell them how much it is and then that's kind of it. There's a lot more requirements on this one, but if you are a practice that's already doing this, then you could just gather up the documentation for the next 90 days and that would be it. So this is a medium weighted activity and the activity ID is IABE24. Next slide, please. The next section is patient safety and practice assessment. This focuses on improving office policies and workflows to improve patient outcomes. Next slide, please. This is another one of my favorite activities. I have a lot from this one as well. Would you participate in a maintenance of certification for board certified physician? So in this case, not every provider, depending on your specialty, would be able to participate in an activity such as this. However, if you check with your certifying board and find out if they have a certified improvement, then you could do it. So it will be different from specialty to specialty. So, you know, this, again, it might be, you might not be able to do it based on your specialty, but you can find out what they're currently doing. There might also be some deadlines involved with that, so you may have already had to participate in this one, but it's a good one for maybe next year if it sticks around. This activity is medium weighted. It is IAPSPA2. Next slide, please. Are you participating in a prescription drug monitoring program and using it to inform your decisions on when to prescribe narcotics? You must review 75% of your applicable patient's drug history through the state's prescription drug monitoring website before prescribing narcotics, just to find out if they've recently been prescribed narcotics and use that information to inform your decision about whether or not you're going to prescribe them the narcotic or other controlled substance. If you participate in this, you will be able to get extra credit points on your PI category, I believe. This is a high-weighted activity, and it is IAPSPA6. Next slide, please. Are you using the data from your quality clinical data registry to help with patient safety outcomes? So your registry may or may not be a quality clinical data registry, a QCDR. Not all registries are, but if it's pretty likely if your registry is through a specialty society, like the American Academy of whatever. So if they own it, it's pretty likely that you have a QCDR, but you would have to ask the registry. If they are not a QCDR, then this activity is not for you. But if they are, then you could choose a measure that would help you standardize practices or change your workflows, that kind of thing, and analyze the data that you've received from the QCDR to protect patients' outcomes, provide patient safety, make changes and improvements to help your patients out. This is a medium weighted activity, and it is IAPSPA7. Next slide, please. Do you want to sign up for the AMA Steps Forward program? The American Medical Association's Steps Forward program can be found at that website. It's pretty simple. If you have done it or want to do it, sign up, and this activity is a medium weighted activity, and the ID is IAPSPA9. Next slide, please. Do the providers at your practice need to standardize a treatment protocol? I really like this measure. This is kind of a make it your own measure that I really appreciate. So basically what you need to do is identify if there is a treatment protocol or a diagnosis that your doctors differ on. And then what you would do is have a meeting to standardize that treatment protocol. You would have to have evidence-based research in your documentation, and then you would have to include an implementation plan, so a step-by-step. But if you have doctors that have differing opinions on a particular treatment plan, and you just need to have an excuse to get them on the same page, this is perfect for you. So this is a wonderful activity. It's medium weight, and it is IA-PSPA 16. Next slide, please. Here we go. Are you interested in completing the CDC drug overdose training module? It's the drug overdose training module that you can sign up for there at that website. This one is one that can only be done once every 4 years. So this is one of those ones that you can't repeat every single year, but you can do it again after it's been 4 years. So if that sounds like something that you're interested in doing, this is a medium weight activity, and it is IA-PSPA 22. Next slide, please. In a similar vein, are you interested in completing the CDC drug antibiotic stewardship training module? Again, there is a website there. You must complete the training module with a passing score is the requirement. The note again is that you can only do this once every 4 years, but it is a medium weight activity, and the ID is IA-PSPA 2. Next slide, please. Achieving health equality is a subcategory that promotes the closing of gaps in medical care for underserved communities. Next slide, please. Have you researched or put into practice a plan to reduce healthcare disparities? So if you live in a particular area where there are identifiable or extreme healthcare disparities, this one might be really good for you. You would participate in a community-based participatory research program to identify any healthcare disparities and create an implementation plan to close those gaps. Clinical trials count, and also other types of research alliances. This is a medium weight activity, and the ID is IA-AHE 5. Next slide, please. Are you participating in a rural or healthcare professional shortage area and accept clinical rotation for doctors in training? If you have been identified as being or practicing in a rural area or a healthcare professional shortage area, or HPSA for short, and you can find out if that applies to you at that website at the bottom there, and you accept doctors in training for clinical rotation, then this measure is perfect. It's a high-weighted activity for those of you that are in a rural or HPSA area, and if you're accepting those types of doctors in training, then all you would have to do is gather up the documentation regarding that, schedules, signing up for the program, doctors, then sending the email saying, hey, you're going to get this doctor on this day, whatever kind of documentation associated with that. So I really like this one, but again, it's an activity that maybe not everyone can do, but it's a good one if you can. So this one is a high-weighted activity. If you're a small practice, that's the only thing you would have to do. If you are a large practice, you'd have to pick at least one other measure, perhaps two. This one is IA-AHE 6. Next slide, please. Can you provide information and referrals to free eye care or provide free eye care for underserved communities? This one is broken up into different types of providers. So if you are not an ophthalmologist, then what you would do is provide education and referrals to free eye care in your community, specifically to at-risk or underserved communities. And then if you are an ophthalmologist, then you can also meet this measure by providing the education on comprehensive eye care and free eye care to at-risk or underserved communities. Lots of programs like Infant C or I See America, lots of things going on out there that you can sign up for. And if you are active and receiving those patients, again, you have to make sure that half of your providers are providing those types of services. But if that is something that you're able to do, this is a medium weight activity, and the ID is IA-AHE 7. Next slide, please. Emergency response and preparedness kind of speaks for itself, but this is all about volunteering your skills during a disaster or crisis. Next slide, please. So were you part of a disaster medical assistance team or community emergency responder team for at least 6 months as a volunteer? This one requires 6 months. All of the other activities, the requirement is at least 90 days. But this one requires at least 6 months. So this one is maybe a little more troublesome to get the time to do this. However, if you were able to complete this activity, this is a medium weight activity, and it is IAERP1. Next slide, please. And then have you participated in a domestic or international humanitarian program for at least 60 days? And I want to keep in mind, as well as on the last slide and this one as well, activities that simply involve registration are not sufficient. You must provide the services, and the documentation must include the details and proof of participation. So this one is a high-weighted activity if you are involved in humanitarian programs, whether domestic or international, and it is a high-weighted activity. However, you do have to complete this activity for 60 days, so that might be a little more difficult. This activity ID is IAERP2. Next slide, please. Okay, so now we're going to go over some common activities. Those activities were the glass slipper kind of Cinderella ones. If the shoe fits, it's a perfect match kind of measures. But what if the shoe didn't match? Now you got to go to Payless and get whatever works, right? So these are the more common activities, maybe a little more burdensome, or maybe you'll have to retrofit a little bit in order for it to fit into your practice, but a lot of doctors find success with these measures. Next slide, please. All right, so if none of the other measures that we talked about seem right to you, other providers are finding that these measures are really good ones. So my favorite one of all of these, and I'm going to give you 9 of them, but this one is my favorite, IAEPA1. It is a high-weighted activity. It's one of 2 high-weighted activities. I think there's only one other on this list. But this one is provide 24/7 access to MIPS-eligible clinicians or groups. The name is kind of a misnomer. It was created in 2017. Most of these measures were. So sometimes the name doesn't always indicate what this measure is about. So that, again, is why I encourage you to look at the data validation criteria as well. The objective and the data validation criteria will be in the same cell on the Excel spreadsheet. So check those things out. But the objective of this measure now, it's kind of evolved since 2017, is to reduce the amount of unnecessary emergency or urgent care visits for your patients, or anybody who calls. So providing same day or next day care counts, whether it's during your normal business hours or not. So if they call after hours, you don't necessarily have to see them right then. You can see them the next day if that's appropriate. Or if you are providing services that are outside of your normal business hours, that is also a way that you can meet this measure. You don't have to do both. You can just give the same day, next day visits, or you can provide services outside the normal business hours. Again, remember, 50% of your providers have to provide those types of services, and you have to be able to document those. But a report that proves that you created appointments within a certain time frame would work in this situation. Lots of good documentation opportunities there. So very easy documentation to get a hold of. Lots of different kinds or types of documentation will work for this measure. So I really like this measure. The next measure I like is IAEPA2. This is a medium weighted activity, but in the age of COVID, we're doing this a lot more. So the use of telehealth services that expand the practice access. So if you have times of day that you're not normally available, or you wouldn't be able to take on as many patients due to the pandemic, then if you can prove that telehealth expanded your practice access, then you could use this measure. So this is a good one as well. IACC1 is implementation of use of specialist reports back to the referring clinician or group to close the referral. This requires an EHR, so you do have to utilize your EHR in order to send that specialist report back. So if you are on the receiving end of a referral And after you've seen that patient, you create a letter back to that other physician to let them know, hey buddy, thanks for sending me your patient. This is what I got. This is what we found during the visit. That is your specialist report. If you're utilizing the EHR to create and send those, and you're making improvements to that process, if you were already doing it or you just started doing it, this is a good activity for you. That's a medium weight activity. Next slide, please. Okay, and then more care coordination measures, because I love them so much. Improvement activity CC7 is a medium weight activity. This is regular training and care coordination. We do this a lot in clinical quality experts. We offer the care coordination training and create it and provide the curriculum and provide it to you, actually do the training for you. So in this situation, we would be training on the aspects of care coordination. So making sure staff are up to date on how to do the care coordination, what is expected of them, what kind of time frames we're looking at, what are the workflows, all that kind of stuff, to make sure that the office is providing that information and exchanging that information in a timely fashion to the patient's other providers so that their care is better. So that one's a really good one. I like that one. IACC 12 is care coordination agreements that promote improvements in patient tracking across settings. So this one is very cool because it's you can make friends. So if you have a referral partner that you want to enter into a care coordination agreement with, you would basically decide who's responsible for what parts of that care, that referral. So if I'm referring my patient over to you, then my responsibility is I'm going to give my patient your card and, maybe a map to your office or something, and let them know to contact you. And then I'm going to also send you documentation. I'll send you the clinical note for this patient. And then when you receive the patient, you're going to send me back a specialist report. Specifically, this one is kind of heavily involved with the EHR. It really kind of wants you to agree to send your initial referrals through direct messaging. So that is a big part of this one if you can do that. But it's very cool because when you both enter into the agreement, then you both get credit for the activity. So not just one of you, but both of you. So this is kind of nice. It's a medium weight activity, and you just put in the agreement in writing and then follow the steps, which you're probably already doing anyway. So if you just put it in writing, then it becomes an improvement activity. So very nice one there. IACC 13 is a medium weight activity. It is practice improvements for bilateral exchange of patient information. This is pretty open-ended, but anytime you're exchanging patient information either with them or with another provider or with another facility, if you can identify a part of that office policy or workflow that can, be made better, maybe eliminate bottlenecks or make it more efficient or more timely, that kind of thing, then that is an improvement that you can do. That is a medium weight activity, so you could do this activity there. Next slide, please. There we go. All right, so, I lied. I have two more high-weighted activities. Okay, so IABE6 is a high-weighted activity. This one is perfect if you are interested in doing satisfaction surveys for your patients. So if you're currently already doing surveys, as long as it is through a third-party survey, then you can get credit for this. Sometimes your patient portal will allow you to do patient satisfaction surveys, so look into that option. The other thing is like you can do something like SurveyMonkey or some other kind of program or software that you can purchase to do it. But you would need to follow up on patient experience and satisfaction, and then also not just bring in that information, but also utilize it. So this is a high-weighted activity, so it takes a little bit extra, but you would need to use the information that you gain from the survey to develop and implement an improvement plan. So, and you would have to have documentation of that. So yeah, that's a good activity. A lot of offices I know are already doing something like that. So, IAPSPA 20 is a medium weight activity. This is leadership engagement on regular guidance and demonstrated commitment for implementing practice improvement changes. So this one requires clinical and admin staff to be included on those meetings. So that was kind of what I was referring to at the beginning. You would need to have a designated leadership group, sort of, and again, half of your providers, and then some kind of admin staff, whether that be office manager, practice manager, or like head tech, something like that, head scribe, something like that. When you meet with these people, you would just have to identify an area where you could make improvements. Perhaps you're already doing, monthly office meetings, and you could just sort of make a portion of your meeting devoted to this. And then that would be pretty easy to just take meeting minutes, document any plans or things that you think could be improved, and then, what happened? Did we pull this off with success, or, did it not work? And then go back to the drawing board kind of thing. So that's a nice activity. And then the last activity that I have here is also a high-weighted activity. This is IAAHE1, engagement of new Medicaid patients and follow-up, seeing any Medicaid patients within 10 days of the request for a new patient or new condition visits. This is if you're able to see Medicaid patients only for that new patient or new condition specifically. I know it says follow-up, but again, the names are sometimes misleading. So if the patient is a regular of yours and you want to see them again in 6 months, and they go to your checkout desk and they request an appointment for 6 months, obviously that is outside the scope of this one. But for new patients or patients who have a new condition, if they request an appointment and you're able to provide that within 10 business days, then you are able to use this activity. So it's a commitment to make the changes necessary to do this. If you are not 100% perfect, that is okay. You just need to document that you weren't and what you did to improve upon that. Again, all of these activities are improvements that you're making to your practice. So even if you're not 100% perfect, the fact that you note it down and create a plan to make it better is part of the activity. So you don't have to be 100%, but you do need to make an effort to try to be. So, and that is, again, a high-weighted activity. All right, next slide. We're going to take a moment for our last poll. So on your screen, you've got a question. Please answer that either on your screen or in your control panel. Okay. All right, so thank you very much for coming. We are being sort of sponsored by iCare Leaders, so they have all of these EHR programs if you are interested in learning more about that. Next slide, please. All right, so Laura, take it away.
All right, thank you very much, Megan, and thank you, Jennifer, for driving today's presentation. And also, I would like to thank everyone for their participation in today's poll questions. We're going to open the floor for our Q&A session. The question section of the meeting control panel can be used to submit any question if you have not done so already. And but we're going to go over to a few of our first questions. And first question, Megan, is when is the last day of the year I can start an improvement activity?
So with the exception of some of the improvement activities which have a longer duration, like that one that I said was 6 months, you usually only have to do an improvement activity for 90 days. So technically speaking, you could do the very last 90 days of the year. So if you have not started your improvement activity, it is not too late. You have about a month. October 2nd is the first day of the last 90 days. So you must start your activity on October 2nd or before.
Thank you, Megan. And next question is, can I do measures more than 1 year in a row?
Most measures you can. However, there are some where you will be required to wait. Like I mentioned, the CDC modules, training modules, you're required to wait 4 years in between. There are some other measures. Very few of them have those types of restrictions. So you just check the data validation criteria, and it will mention if you can't. But otherwise, yeah.
Great. Okay, and let me see. The next question is, someone is having some trouble. They're not able to send or receive data electronically through their EHR. So what would you recommend for that?
If they're not able to send or receive, I would encourage them to look into hardships. If they're not able to get that to work, there are plenty of hardships or exceptions or exclusions. So those are mostly in the PI section, the promoting interoperability section that would affect you over on that category. However, some of those measures do have exceptions. If you're doing fewer than 100 outbound referrals or inbound referrals, then you can exclude out of them. Or if you're a small practice, you are allowed to exclude out of that entire category. So if you're having significant issues, then you could look into hardships and exceptions.
Okay. So we'll give another few moments to for somebody to ask any questions. We do have a few that are coming in that are specific to clinics, so we can address those directly for particular software. So I'm just waiting for any general improvement activity questions. We'll give a few moments for that. Okay, well, I think, Megan, you did such a good job that we don't have any incoming questions. So we're going to go ahead.
Hang on just a minute, Laura. I just saw we already used the hardship for that category. You can use the hardship many years in a row. As many years as it applies, you can keep doing it. So if it applied last year and it still applies this year, you can do the hardship. So,
okay.
Yeah.
No. Yeah. Thank you.
Yeah.
Okay.
Oh, we got another
so
question.
Oh, okay. Sorry. Yeah.
Sorry. I just saw another one come through. So how best to report these activities? So how you report these activities is going to be up to you. But in terms of actually giving the information to CMS, these are not claims related, so you can't do claims based. These are not activities that have like a numerator and denominator. So traditionally, we report a numerator denominator, but you can report these activities in the same way that you're reporting your PI or quality in the same place. You can either do that on the QPP website, or sometimes you can do it through a qualified data registry. Through your registry, you can do that. So wherever you're putting your PI and your quality information, you can put your improvement activities there as well, generally speaking. But yeah, if you can't find any place to do it, qpp.cms.gov, you will have to log in to do that and associate your ID with your organization. But if all else fails, you can go do it there. And it's basically just a checkbox. It's the honor system. So you just choose the activities that you have done, and then you can report the time frame for it. I also forgot to mention that you do have flexibility on these. You can report more than one activity in different time frames. So you can use a different reporting period for different measures, and your providers can do those measures in different time frames. So if you've got Dr. A doing one of his activities starting in February, and Dr. B doesn't want to do that until August, that's fine too. But just make sure that throughout the year, your 90-day reporting periods are within the calendar year. And when you go to report it, you're going to use the first day of the first provider and the last day of the last provider.
Okay, thank you. So a reminder that a copy of today's webinar will be made available to you directly for our participants, and it will also be posted on our website, www.clinicalqualityexperts.com. The website will also allow you to subscribe to receive our blog, tips, and also our newsletters. So be sure to sign up for that if you're interested. We do try to provide educational resources to you throughout the quarter as information becomes available from CMS or from ONC. So I would like to thank our experts, Megan and Jennifer, for providing such great information today, and also to all of our viewers for taking the time out of your busy day to join us. Thank you very much, everybody.
Thank you.
Thank you.